Harvard University. His work focuses on the determinants of city growth and the role of cities as centers of idea transmission. If I went through his entire CV, I would take up the time we have allocated for his keynote. So in the interest of time, I will desist. But I do want to flag his latest book, Survival of the City, Living and Thriving in an Age of Isolation, jointly authored with David Cutler. It's a fascinating read, highly recommended, that tackles the question of whether and how cities can emerge intact from the present turmoil caused by the COVID-19 pandemic. The book explains, and I'm sure Ed will tell us a bit more about it, why cities and their economies were so vulnerable to COVID-19, and offers a blueprint for addressing the vast disparities in health and economic mobility that have been spotlighted and indeed amplified in the past 2 years. So Ed, a simple question to you. As we deal with the pandemic recovery and try to increase resilience, respond to the urgency of mitigating and adapting to climate change, address increasing inequalities, and harness technology, what will make cities survive and thrive? How can urbanization be truly harnessed to achieve sustainable development? The floor is yours with that very simple question. Ed, you're muted. I believe you need to unmute.
Okay, so wonderful. Thank you so much for inviting me. I'm so glad to be with you here today. As we just said, I'm going to talk about things that are in my new book. Now, if I were giving this talk in 2019 or 2018, I would start with a couple of graphs like these two. This one just shows the relationship between urbanization and income growth, per capita income growth between 1960 and 2010. This just shows the astounding role that urbanization has played in making the world wealthier. It is not that I have ever believed that we should artificially boost urbanization, but rather that I know of no path from poverty to prosperity that does not run through city streets. And so, despite all their difficulties, despite the enormous challenges with dealing with the demons of density, like contagious disease, like traffic congestion, like crime, right? It is one of the highest vocations of the 21st century to try to make the cities of the developing world more livable and more humane, because they are our best path towards progress. They are also our best path towards global sustainability. This shows a map of carbon emissions associated with living in different parts of Boston. And what this map shows you is the places that look green are brown and the places that look brown are green. This comes from joint work with USC environmental economist Matthew Kahn, where we've measured carbon emissions associated with living and transport. And you find ultimately that people who live in dense, compact areas use much less carbon than places that are sprawling, that have large homes and have long drives. This is not to say that the overall process of urbanization and wealth creation will not involve more carbon. But if the great growing economies of India and China on their own see their per capita carbon emissions rise to that level seen in the sprawling United States, global carbon emissions go up by 130%. If they stop at the level seen at wealthy but hyperdense Hong Kong, global carbon emissions go up by less than 30%. We all have a lot to gain by seeing the cities of the developing world reach up to the sky rather than sprawl out to the distant lands. Now, of course, in the last almost 2 years now, we have been reminded that cities are also places of terrible disease, right? That in fact, contagion, pandemic is one of the oldest companions of urban life. Perhaps our first well-documented urban plague is the Plague of Athens, which hit that city in 430 BCE. Now, the backstory for that, of course, is that Athens was doing all that you could possibly ask a city to do. It was a place of enormous genius where smart people were connected by urban density. And you had incredible breakthroughs in the arts, in architecture, in sculpture, in drama, in economics, in government, in democracy itself, in the creation of history, right? Athens was an enormously successful city. Unfortunately, that also excited the rivalry of its land-based military rival, Sparta. And so a war broke out in 430 BCE between Athens and Sparta, the so-called Peloponnesian War. The leader of Athens during this time period, Pericles, had a clever strategy, which he thought would win the war. He summoned the Athenians behind the walls of the city, trusting to those walls to keep out the Spartan attackers, and sent forth the Athenian navy, which was vastly superior, to harass the shoreline of the Peloponnesian Peninsula. As military strategy, it was perfectly sensible. The walls indeed kept out the Spartan warriors, but walls that prevent invasion by people may not prevent the intrusion of a virus or a bacteria. And so plague entered through the port of Piraeus. Cities then as now are vulnerable, in part because they are the nodes on our global lattice of travel and trade. They are the ports of entry for goods, for people, for ideas, and for viruses. Thucydides, one of the two fathers of history, was there, and he describes a city that has gone amok, in which people lived only for the day because they did not expect to see tomorrow. Now, perhaps 1/4 of the Athenian population died within 2 years. The city would soldier on. It would survive for another 25 years in the war with Sparta before eventually losing, but its glory was forever dimmed. It would then move from being perhaps the New York City of the Mediterranean world to perhaps being its Boston, its Baltimore, and then eventually its Cambridge, Massachusetts. Now, Athens was struck so hard by the disease because it was weak, it was vulnerable at the time the disease struck, it was already at war. And that's really a critical point about natural disasters. The impact of any form of natural disaster, like a pandemic, is mediated by the strength of civil society at the time when it hits. The plague of Justinian, perhaps the most devastating of all urban plagues, strikes just at a moment where the Eastern Roman Empire is preparing to reimpose the Pax Romana on the Mediterranean world. It is the maximally vulnerable moment, and so it completely destabilizes Europe. Comes again for 2 centuries, plunging Europe into almost a millennia of darkness. But for most of the past, almost 6 centuries, our urban world has been relatively robust to pandemic. It is not that these events have not been terrible demographic catastrophes, but our cities have soldiered through them. In the 19th century, an early age of globalization, diseases emerged and struck down the cities of the wealthy world with a great deal of regularity, and yet the cities continued growing. So in the early 19th century, yellow fever emerged out of Africa, a mosquito-borne illness carried across the Caribbean, and then up to the eastern seaboard. The death rates, as you can see here, were often 3% per annum from yellow fever. That's about 10 times what the death rate was from COVID-19, and yet New York City kept growing. Cholera emerges in the Ganges Delta in 1817, carried over land by the British army, carried over land by the Tsar's army, and eventually overseas to London, to Paris, and to New York. Perhaps 5% of New York's population died. One of the reasons why cities continue to grow is that the poor will come to cities despite the risk of dying because they're poor, because they're seeking some form of a brighter future. The same thing is true today. The risk of pandemic did not stop the desire of many people to be in the great cities of the developing world that are offering pathways out of poverty. But also because, and this is our great hope going forward, the cities of the West invested in themselves. The cities of the West took actions to make themselves more robust against pandemic. And one of the great tragedies of the 19th century is whereas London invested in sewers that would make itself robust, the British overlords of India did not invest in Indian sewers. And so the Indians continued to die in vast numbers. And that's a story that I tell in chapter 2 of my book. But in the West, in the wealthy West, things like aqueducts and sewers were built. You always needed incentives as well as infrastructure. So you can see on this graph, the Croat Aqueduct was built in 1842, and yet for 25 years afterwards, New York City continued to die of cholera. My great-great-great-grandfather died in the 1849 cholera epidemic in New York. The reason for that is exactly the same problem we see in sub-Saharan Africa today, and I work on water in Zambia, which is the last mile problem. You had water mains that had been delivered, you had cholera, you had aqueducts that had been delivered, and yet poor people were unwilling to pay for the connection to the water system. It was not until you had the Board of Health established in 1866, which started imposing rules and started imposing fines on tenement owners that you got these connections, that you forced people to give up their shallow wells, their boreholes, their pit latrines, and move over to the water system. And after that, you see cholera rates decline. Now, none of this was cheap. America's cities and towns were spending as much on clean water at the start of the 20th century as our national government was spending on everything except for the post office and the army, but it was worth it. Investing in water systems, investing in cities ultimately pays. And for the past century, we have had a blessed 100 years in the West in which pandemic has been remarkably absent. And so we have forgotten the fact that urban density can spread disease, that plagues can enter through cities. And then all of a sudden, COVID-19 happened. In the early days in the US, it was a very urban plague. because tourists returning from Italy brought in the disease into places like New York and Boston. And you can see this is the spread of the disease as of April 30th, 2020. Primarily, this is about the ports of entry. But of course, in the developing world, it was also about the fact that density enables the spread of disease within the city, right? That we're closer to each other, and especially in informal settlements. This shows the spread of the disease and its relationship to the share of the population living in a favela in Brazil, right? In a favela, in a slum, in a township, there's no such thing as social isolation. There's no such thing as social distancing. And so the plague spreads easily. This shows the share of the population living in slums in India and this rate of infections in the early months of the disease. The remarkable serological work of Anup Milani, who measured the presence of COVID-19 antibodies in the blood of Mumbai slum residents in July 2020, found that more than 1/2 of those residents had had the disease by July. Somewhat remarkably, the death rates appear to have been relatively low, in part because slum dwellers tend to be young and they tend to be thin. And so their very poverty, in a sense, protected them from the comorbidities that made COVID so deadly in the wealthy world. Of course, an airborne pandemic, unlike a waterborne pandemic, can spread anywhere. And so by November 30th, 2020, this was a disease that was more prevalent in the Dakotas, in the most far-flung parts of the US, which was true also of the influenza pandemic of 1918, 1919. And within cities, within particularly the wealthy cities of the West, tall towers were not particularly associated with the disease. This is a map of New York City. And for those of you who don't know, this thing is Manhattan. This is where the tallest buildings are. This thing is Brooklyn Heights. This is also where tall buildings are. This is the Bronx. This is Queens. This is Staten Island. And what you can see from this map is that COVID was most prevalent in New York, where density was lowest, okay? In fact, the areas that were most highly built up were the areas where COVID was least prevalent. The reason for this is the behavioral response, that it was mobility, not density, that drove the spread of the disease. This has been the first pandemic in history where we've been able to measure mobility through things like cell phone records, and this comes from SafeGraph. And you can see here that in those densest areas, you had the sharpest reductions in mobility, not because those people were smarter, not because they were innately healthier, but because they were luckier, because they were richer, because they were in occupations that enabled them to zoom their way to employment. And they had a much lower rate of getting sick. This has been a profoundly unequal pandemic. During 2020, death rates soared for the poor, and they did not even change at all for the rich in the US. And mobility had a lot to do with it. We've estimated that for every 10% you were able to reduce your trips during the early months of 2020, your COVID case rates declined by 20%. So really a 2-to-1 ratio, which is huge. Now, of course, what's also happened is that our economy has proven to be remarkably vulnerable to COVID, especially so in the developing world. So the economic fallout from COVID in South Africa has just been absolutely extraordinary. And this reflects a transformation. So in the medieval period, when Black Death came to Europe in 1350, this was a purely subsistence agriculture economy. And in an economy based around agriculture, wealth is determined by the amount of land per capita. And so when 1/3 of Europe's population died, and that was a demographic catastrophe, but the land that was left, that stayed the same. And so per person, you had 50% more land. Right? The people who were left actually saw their wages bid up extraordinarily because people were desperate for labor because of the labor shortages that followed the death. Flash forward to the influenza pandemic of 1918, 1919, during this industrial economy. The work of Francois Veld of the Chicago Fed shows that, in fact, there was a short, sharp recession when this hit. Factories shut down, mines were shuttered because, in fact, people were sick. But as soon as they got well, the demand for the industrial products surged again. No one was afraid of getting the disease from buying an icebox, from buying a car. Move forward 100 years to the great service economy, where automation and outsourcing has caused a disappearance of factory jobs in the West. And even in the developing world, cities are defined more by services than they are by manufacturing. Now, in a sense, the ability to serve a cappuccino with a smile has been an employment safe haven in an era of large-scale automation in factories. And yet those jobs can disappear in a heartbeat when those smiles become a source of peril rather than a source of pleasure. And so we've seen a shutting down of the great urban service economy, which employed 1/5 of Americans in 2019, 32 million working in leisure, hospitality, and retail trade. Now, in some sense, one of the big questions we have going forward is, will we ever get back to the office? overall in the US economy, we have gone from having 50 million Americans who are working remotely in May 2020 to having 20 million Americans working remotely. So 60% have gone back. But in our densest cities, in our fanciest office towers, occupancy rates are still very, very low. This comes from Castle, which is it's an access control system, meaning that you swipe your fob or you swipe your card to get in. So these are fairly fancy office buildings. But as you can see, this shows offices that are still shuttered. Now, I think, in fact, and so many people have asked the question, will these new technologies like Zoom, which we're doing right now, will it make face-to-face contact in the cities that enable that contact obsolete? I have been, thinking about this issue for at least 30 years. The great futurist Alvin Toffler in 1980 wrote a book called The Third Wave, when he argued that information technology of the period would make offices obsolete, would turn New York into a forest of empty skyscrapers. And for 40 years, he's been completely and totally wrong. And I think once we get past this pandemic, he will be wrong again, in large part because what globalization, what new technologies have done is they've radically increased the returns to being smart. They've radically increased the returns to innovation. And we are a social species that gets smart by being around other smart people. Even studies like the remarkable work of the great Nick Bloom of Stanford University, or the work of our students, Natalia Emanuel and Emma Harrington, that find that when you send call center workers home, they're just as productive at home as they are at work. Even these studies show a tremendous decline in the amount of dynamic growth. So both studies show that your probability of being promoted, if you're a call center worker, goes down by more than a half if you're remote. Now, what does promoted mean? And you can see these two lines here. The blue line is on-site, the red line is remote. What promoted is, if you're call center workers, you get given the difficult calls, the real pains in the neck to deal with. Now, how would you learn how to deal with difficult calls if you were remote? How would your boss learn that you were good at handling them? And in some sense, you've shut down the learning channel that is so crucial to success in the 21st century. For the same reason, we've seen new hiring dry up for remote jobs. This work looks at both employment, which is the red line, and new postings on burning glass technology. So this is virtually the universe of online postings for these jobs. On your left is those jobs that have to be done live. During the initial months of the pandemic, live employment plummeted, and so did postings, but it came back. On your right is jobs that can be done remotely. You can see employment is rock steady, but new postings has collapsed by 40% and it stayed down for 18 months. So while Microsoft has told us that their programmers are just as productive working at home, overall new postings for programmers are down by more than 40% because people are unwilling, unable to onboard new workers via Zoom. And anyone who's ever taught knows, right? Anyone who's ever taught knows that, in fact, teaching is very, very difficult over Zoom. Most of our studies of remote learning find that remote teaching is somewhere between dismal and counterproductive. It is so bad. And of course, it has been incredibly unequal. This just shows the education distribution of working remotely during the height of the Zoom revolution. This shows us that while 68.9% of Americans with advanced degrees were working remotely in May 2020, only 5% of Americans who were high school dropouts were working remotely. Only 15% of Americans who had just high school degrees were working remotely. And so if you imagine a world of remote work, you're imagining a world that is even more vastly unequal than the world that we had before us. Now, this does not mean that I think that hybrid work is over or that this won't have an impact. Global talent has just gotten more mobile. That means that cities will need to compete even more fiercely to attract the talented. And this does give opportunities for the smart and the well-educated in the developing world. But it is not a reason to think that urban density is gone or that cities are gone. I will just end with one final observation, which is when you think about what this pandemic means, and you think about what these months of social distancing has meant, one lesson of this is that, in fact, that all of us should remember is that this Zoom world is not the same as living live. And we really need to cherish every connection that we have in person, that we really need to cherish each other and remember how remarkable our and how important our social connections are. The second thing to remember is that a disease that starts anywhere can spread anywhere. And consequently, it is crucial that the developed world, that the wealthy world, double down on its commitment to the health of the cities in the developing world. That, in fact, investing in sewers in Hyderabad or investing in health in Addis Ababa, right? These are not minor things for the wealthy world. And so we have been championing in our book the idea of something like a NATO for health, something like a global alliance that is empowered, that is able to monitor health and that invests seriously in the health of the developing world, right? In exchange for a deal in which they accept hygienic rules in exchange for aid. And so I think SDG is just a great way for us to think about the fact that we're all in this together and that we really need to invest in the cities of every country, no matter how rich and how poor. But I will end with one final comment, which is this has been a tough period for our urban world, but cities are amazingly resilient. They have faced worse. They will get through this. They have been doing miraculous things since Socrates and Plato bickered on an Athenian street corner. And I know whether it is in Cape Town or Bangalore or Shanghai, that the age of urban miracles is not over and that amazing things will still come from smart, creative people who are empowered by proximity to each other. Thank you very much. Thank you for all that all of you do for cities.
Thank you very much, Ed. Thank you, first of all, for that hopeful message on the robustness and the resilience of cities through history. I think we all needed and need a reminder of that from time to time. I think also the fact that, you know, the path from poverty to prosperity runs through city streets, very, very important. We haven't seen any other pathway that is equally effective as urbanization in terms of going from poverty to prosperity. Then the entire discussion around remote work and whether cities are doomed in the sense of their culture, their density, their, you know, the urban space, and the data around that, which is showing us that no, indeed, that's not going to be the case. And the fact that we are social beings and we are learning beings, and if you go remote, you put that learning dimension completely out of the equation. So I think all of those very, very important. And finally, a message around your message around investing in the basic space. You know, and I think perhaps I'd like to maybe ask you to develop on one final point related to that. What does this mean for planning and infrastructure? Because I think, you know, we've talked about planned urbanization, well planned, well managed, as Raf was saying. How do we make sure that we make that connection between planning, infrastructure, and resilience of cities and resilience of the planet as a whole? So maybe just that as a follow-up before we let you go.
It's a great question. And I think the way that I think about it is the critical element about all physical infrastructure is that it needs to start with a simple observation that cities aren't buildings, they're not streets, they're not subways, they're people, okay? And all infrastructure and all planning must ultimately understand that its job is to empower and to protect ordinary people. It's to enable ordinary people to move around, right? It's to enable ordinary people to drink water without getting sick. And it's to enable children to be able to go to school without looking over their shoulders in fear. This is our job, right? This is our job, is to figure out how to create cities that do that. And so we must constantly interact with the actual experience of the infrastructure, because it's not enough to theorize about what, you know, this beautiful building or what this structure must do. We must rigorously evaluate what's going on and always, always understand that this is about, you know, this is about humanity that is empowered by our cities.
Thank you very much indeed. This is about people. It's about empowering, protecting, and advancing them on this path to prosperity. And planning really needs to do that. Music to a planner's ears, I tell you. Thank you very much again for taking the time to join us. And I'm sure this is the beginning rather than the end of this conversation with you. So thank you, and we'll allow you to leave as we move on to the panel, which I will now introduce.
Wonderful. Thank you so much.
Thank you. Let me now go to our panel, which will reflect on some of the ideas and insights that Ed just shared with us. We have with us, first of all, Ms. Emilia Saiz, Secretary General of UCLG, an old collaborator, co-conspirator, a tireless champion and advocate for local governments around the world. Emilia has worked, of course, with the international movement of local and regional governments in different capacities since the 1990s, and as Secretary General of United Cities and Local Governments, which is an umbrella global network of cities and local, regional, and metropolitan governments and their associations since 2017. I know more than anyone else what a critical role Emilia played in the setting up of the Global Task Force of Local and Regional Governments, and how loud a voice she has been of local and regional governments in international processes, Rio, Beijing +20, the climate agreement, the Agenda 2030, and of course, Habitat 3 and the New Urban Agenda. So welcome, Emilia. We also have on the panel Dr. Greg Munro, Director of the Cities Alliance since May this year. Prior to this role, Dr. Munro served as Secretary General of the Commonwealth Local Governments Forum, also championing localization of the global development agendas across the Commonwealth and beyond. Dr. Munro has a background in public health, local government, and has wide international experience, development experience across 40 countries. And he's previously held various positions with the International HIV/AIDS Alliance, UNAIDS, the World Bank, and with local governments in Cape Town and Durban. So welcome also to Greg to our panel. And last, but certainly not the least, we have Dr. Eduardo Lopez Moreno, who is in charge currently of the External Relations, Strategy, Knowledge, and Innovation Division of UN Habitat. Professor Moreno, as he's affectionately known as in UN Habitat, has been leading UN Habitat's data, research, and knowledge work for the past several decades. Eduardo is an architect with a PhD in urban geography from the University of Paris 3, Sorbonne. He's an extensively published author, but also a renowned and highly awarded photographer who captures the harshness of urban reality, as well as the hope that cities offer, as much through his camera lens as through his numbers and his words. So welcome to all of you to this session. I'm delighted to have you. We have heard from Ed Glaeser on how cities can survive and thrive in the coming decades. But what do cities need to do to make this happen? Emilia, you are a champion of empowered local government. Let's maybe start with you on your reflections. Maybe we'll take a first round and then run this as a conversation, as a freewheeling conversation. What are you hearing, and what do we need to do to make cities not just survive, but thrive?
Yeah, obviously, I love, since I work with cities, with local governments and territories, I love to hear that the age of urban miracles is not over, and we are all fans of Ed. And I really welcome that message, because for me, a positive and hope message for cities, for urban spaces, is a message for hope for our species, for humanity in general. And we need to take into account that the urban era is not only about cities, and certainly not only about big cities, but it's about cities big and small, and their symbiotic relationship with territories. And for me, this is a very critical aspect of what we need to discuss today. I very much agree with the assessment of Ed, of course, that has done a lot of studies and research, and his narrative is very well built up. The only thing that I would signal here is that the kind of crisis that we are facing today is not solely a health crisis, and that the specific challenge of this crisis is that it is a crisis that overlaps with other crises that we've been having for a very, very long time. And they are speeding up in their urgency. Like time we don't have as much time anymore. And this is what makes this juncture, this context, so special and so critical. So the climate emergency, the poverty emergency, which I would describe like inequality emergency, is piling up on the health emergency, and it makes it universal, and that is what is so special and so unlike all of the examples that he has given. And so it will have a different impact, and we will need to tackle it in a different way. My second concept is, well, we need to take all of these complex crises piling up on each other, and we also need to realize that it will not be about technical solutions. It will not be about technical solutions this time. It's not about aqueducts. It's not about investing in many new infrastructures for a big part of the world. It is about ensuring that inequalities do not exist. And that involves also technical solutions and investment. But inequalities is what we will need to address if we want this crisis to be overcome. So the survival of the species is very linked to that. And for us, I say for us, for our constituency, for United Cities and local governments, but beyond us to the other networks, guaranteeing public service provision is going to be the key. And this is very linked with the SDGs and how we see SDGs as still very valid frameworks. But we need to make sure that this public service delivery is geared around overcoming inequalities, because it's going to be the only thing that is going to help us address this. I would even argue that it's just as important to overcome the climate crisis, because some of the solutions that we need to seek are not only about carbon emissions, but about how our world is structured. And the emptiness of some of the shops in the UK, but the problems that we also have in getting chips for our cars and for our things in many parts of the world is related to inequalities and to the models of production and consumption. So those three thoughts is what I would like to give. Is not about cities, it's about the dreams and the miracle of humanity. Is not only about technical solutions, but about the will to overcome inequality. And if you want to do that, you need different local service provision with more capacities, more empowerment, and at a different place in the governance discussion. So I'll stop here, Cipra, so that we have a chance to discuss with the others.
Indeed, and I will come back on some of those points, as I'm sure our other panelists will. Emilia, thank you very much. Very, very important. It's universal. It's not about technical solutions. It's really about different models that we're talking about. Models of the economies, models of society, models of governance, that we are really talking about, and the political will to really look at those different models. That it's not, the old experiment has failed, and we need a new model or a new set of models. So thank you very much for those. Maybe bringing in Greg at this moment. Greg, you've heard Professor Glaeser, you've heard Emilia. You, of course, Cities Alliance works a lot with smaller and intermediary cities. Give us some thoughts on, how this is going to be addressed through collaborative action or through strategic investments in small and intermediary cities. Is that what we're looking for, or is there something else that we need to focus on?
Thanks. So just to start, and I wasn't going to mention anything about health like I normally do because of my background, but I'm afraid Professor Glaeser's presentation pushed all my public health buttons. But so just, I think it's important for us to remember that we're talking about people, and Emilia has spoken about humanity. 2,200 children die of diarrhea every day. Even more die of pneumonia. Over 250,000 under 5-year-olds still die of malaria every year. And often because of these issues around not managing surface water. And these are diseases of poverty. These are diseases of overcrowding. These are diseases of lack of basic services and lack of water and lack of sanitation. And in some of the slums in Nairobi, if you are under 5, you are 8 times more likely to die than the average under 5-year-old, and 50 times more likely to die than children in the most developed nations. Deaths are much worse in informal settlements, and also much worse in secondary cities. And the reason why, and this is why Cities Alliance focuses not exclusively, but the major part of our work is on secondary cities, is they are the fastest growing urban areas. 75% of the world's population live in urban settlements of fewer than 500,000 people. And this number will only increase. And in many African countries where the doubling rate was 15 to 25 years, it's now come down to 10 to 12 years. And they face rapid urbanization through rural-urban migration, natural growth, and cross-boundary migration. Many of these cities are also poor and struggling. The rapid urbanization has come at considerable environmental and social cost. Many of these cities are poor and overcome by the pressures of development resulting from urbanization. They often have weak governance systems, and urban development takes place which is uncontrolled, with little urban infrastructure and little ability to provide services. UNICEF states now that children in slums in our cities, their health is much worse. They are much worse off than the similar children in rural areas. So urbanizing should be a positive thing, but for many, many people it's not, because these secondary cities cannot actually respond to the needs. But yet there are positives, because these secondary cities are the economic backbone of some of the world's largest cities. And while they produce around 40% of the world's GDP, they provide the resources needed to support the development and operations of the world's biggest cities, which produce 60% of the world's GDP. They are unfortunately often eclipsed by the big primary cities, and globally there's a growing gap at levels of socioeconomic development disparities between them. Capacity for planning is also is limited, and very few have adopted integrated strategic planning, linking spatial plans to the development of infrastructure, land development, public finance, and long-term financial planning. But many of these cities can benefit from the excellent knowledge tools which organizations like UN Habitat, World Bank, Cities Alliance, and many others have. And it's about how do we get some of these tools and capacity to the secondary cities. So I'll stop there and we'll see if there's another round.
Great, thank you, Greg. And that's the perfect segue, I think, to Eduardo. In terms of, we have all these tools, how do we get them to cities, secondary cities? How do we build up data and evidence-based policy making in some of these cities? And which obviously is essential if they are to not just survive but thrive in the post-pandemic world. Thanks, Greg. Over to you, Eduardo.
Thank you very much, Shipra. First of all, let me say that I really enjoy Mr. Glaeser's presentation and his books. I like a lot this connection to history. And let me start 1 minute with something to recall interesting, is that there was a classic Greek construct that was pharmakon. Pharmakon was both a poison and a remedy that was coexisting, not as an opposition, but as a complementarity in cities. And Plato's dialogue on Phaedrus talks about cities that were at the same time the drug, the poison, and the remedy. And there was something very interesting, a pharmakos that was a person, and we are talking about around 370 before Christ, that used sacrificial rituals to purify the city. And this for invasion, for famine, for war, and even for plague, which will be COVID. And pharmakos, this person was normally a slave. He was a criminal, he was a cripple, and he was expelled sometimes formally from the city, but sometimes even beaten, stoned, executed. So pharmakon was two things, and a third one, a scapegoat. And I'm saying this because when this classical Greek philosophy went from the Arabic and the Persian world to the Western world, the translation could not have double meanings or triple meanings, even worse. Then pharmakos and pharmakon was translated only on the positive, the pharmacologist and the physician. And as Heraclitus said, we lost the richness of the opposites, which was to coexist in a city in something that can be a binary opposition. And because of that, we try to sanitize the city. And the new normal, to some extent, is not integrating this fundamental notion of operationalizing multiple meanings and concepts and the way the city operates. And in my view, we need to come back to this fundamental discussion that the city contains the virus, but also the remedy, the plague and the pandemic and the health conditions. And all this is important to rethink how we are going to respond to cities today. Somehow connected to what the last speaker mentioned on the need to integrate health, but to integrate health in this perspective. 2 or 3 comments on this presentation. The first one is at the very beginning, I must confess that I got a bit scared when Mr. Glaeser mentioned that density was the culprit of the pandemic, but later on with his example and the data on New York clarified that point to me. Richard Florida presented very good data on Soria and Madrid, Soria being 10 times less dense than Madrid and 10 times more cases than Madrid, World Bank in China and UN Habitat studies. All this to say that UN Habitat prepared this cities and pandemic report that is not only a report, it's also a database, a very important database. I would say with the lack of modesty, perhaps the most authoritative database at the multilateral level, in which we analyze 1,700 cities in the world. We analyze how cities were before the pandemic in terms of preparedness, how they were hit not only in the health conditions, in the social and the economic, and we also analyze what kind of responses they instrumented. And I fully agree with Emilia and Dr. Glaeser on the fact that as the Secretary General of the UN mentioned, the pandemic was an X-ray that exposed us. It exposed us, but also illuminated us. Illuminated and UN Habitat in this database. Let me complement some of the figures that were mentioned. In some countries, 62% of work-related activities of different type of works were synthesized to 10, 12 works. In other words, 10, 12 works that were related to proximity, that were related to the possibility of handling with other people goods, not protected in the environment of work, were culprit for a lot of infection and death. In France, our analysis showed that the lowest fifth of the quintile was responsible for 60%, not responsible, were affected by 60% of deaths. In Mexico, my own country, 72% of people that die did not finalize primary education, but they represent less than 20%. And in the Arab world, very little data, but in the cases we have data, those people living in confinement areas were affected up to 95% of COVID in some of these countries. This to say that because of this analysis, also some form of policy responses, we came with a proposal that I would like in the minutes that I have to submit to your consideration. I like a lot Emilia's analysis on the need to address inclusion or forms of exclusion and marginalization. And connected to what Dr. Glaeser mentioned, we study new forms of vulnerability and we draw new maps of vulnerability. And we found that 3 elements in cities were to large extent responsible for infection and disease. Number 1, we call vulnerability associated to place, which obviously has to do with overcrowding and the place we work, the place you live, sorry, in terms of lack of social distancing and things like that. The second, as Dr. Glaeser mentioned, we call it vulnerability associated to mobility, inadequate public transport, and third, vulnerabilities associated to the type of work that people were performing. And these 3 vulnerabilities drawn in cities are strongly connected with what Emilia said in the need to have responses that have to do with equity and that have to do not only, and here is an interesting concept, this notion of building back better or resilience in my will require a new conceptual thinking in the sense that resilience is a lot keeping the status quo, the system, protecting the poor, shielding the poor, but not changing conditions, not addressing structural inequalities. And in my view, the discussion should be at that level. Second, which is at the heart of this discussion today, we analyzed the cities in the world that were having the better response in terms of protection and later on addressing cases of COVID. And we found something quite interesting, is the cities that act at the very local, and let me call the very local neighborhood, which can have different names in different places. And I'm not talking about lower administrative units of demarcations. I'm talking about cultural construction of places were extremely important in order to address the pandemic and recreate or reconfigure a new governance mechanism in cities in which local responses, in what we call later on in UN Habitat, ecological and sustainable neighborhoods, were the best mechanisms to address the pandemic, and from them building this governance mechanism, the economic responses, the health responses. So we advocate, which is somehow or very close to the 15-minute city, on this ecological and neighborhood, but a big difference, two, in my view. One,
Eduardo, I have to ask you to wrap.
Yes, I'm concluding. We need to include in these communities, of course, and we need to include also the space as a vector of change. So all these elements to say that we will, and a strong disagreement with Dr. Glaeser in NATO and UN, just to say, because peace and prosperity that both are looking at this international law, security, but UN deals with health, NATO doesn't, and I don't see why we need to duplicate large, heavy bureaucratic institutions, but to concentrate in what we have. Thank you very much.
I can see Emilia nodding vigorously on that one. I think, and Greg would also agree, the point is to empower the thousands and hundreds and thousands of local governments, regional governments, rather than building another top-heavy NATO to fight the pandemic and to change the systems. Emilia and Greg, any reflections on what you just also heard from Eduardo? New maps of vulnerability. How do we address a vulnerability which is often, not both, often place-based, economy or action-based, mobility-based? How are we going to address these new complexities, these new complex forms of vulnerability? Emilia, perhaps you first, and then Greg has a minute to think about his response as well.
Yeah, well, first of all, I do really like the reactions of Eduardo and Greg as well, and I think we are very much aligned. From the perspective of local and regional governments, it's not only about empowering local and regional governments, which we certainly do need to do, but my comment on the NATO was of that new NATO of health is about, let us strengthen the multilateral system that we have, and let us make sure, because NATO leaves a lot of people out. We need the global south to play a different role here, and so strengthening the multilateral system that we have with new stakeholders would be really good. And giving the World Health Organization true powers is also something that I would take into account. But going back to this mapping and models, this mapping of vulnerabilities, you know, it's not only about mapping, and I'm sure Eduardo didn't mean it that way, but just that change of addressing, putting vulnerabilities at the center of what you're trying to do is also something that will differentiate us from the way that we dealt with these things in the past, in history. And for us, it means local service provision around care. Cities need to care now. They need to provide care, because we are wealthy enough as a world, I'm saying. We are wealthy enough and wise enough, and we have enough technical means to transform our systems into care. If we agree that our cities are only as strong as the weakest of our neighbors, then you start developing a local service provision that is different. And this is something that with Cities Alliance we have been working on for a very long time. The acceptance that we all need to have as humanity, that we have been tolerating inequality and that we have been building on inequality. So if you do that, if you take that as the core of the new type of service provision that you need to realize, then you come into a kind of a care society that will develop new service provision. And in fact, like Eduardo was saying, COVID has enlightened us. And in fact, that means that we have learned that some of the temporary service provision that we have been providing to overcome the worst of the pandemic are things that need to stay. And how do we make it stay? How do we make them permanent? That is the next big question that, that we have. So for me, putting care at the center of what we do is extremely important, and it will help us reshape the models that we have.
Great, thank you so much, Emilia. I will leave some reflections on this for the end, but Greg, over to you.
Thanks. So, one of the things that we all in the urban and local government space talk about is know your city. And part of knowing your city is also making sure you know where the vulnerabilities are, mapping where the greatest needs are. But it's not just a case of knowing. I mean, the response and the responding to this also speaks to one of the big deliverables of Cities Alliance, and that is very inclusive city development strategies. And one where it starts from the premise that a city stands or falls depending on the success of the entire city, not just parts of that city. And COVID showed that to us. The city is vulnerable from COVID, even if one part of that city is vulnerable from COVID. And when you've got people living in poverty who can't wash their hands, they cannot socially distance, then the entire city remains vulnerable. We saw that in the economies, where the formal economy was we discovered how dependent it was on the informal economy in terms of supply chains and many of our cities. So the city stands or falls as one. So in our city development strategies, we also see people living in informal settlements and who are new migrants as being a huge opportunity for the cities, because these people come with skills and hard work and the ability to help build that city. So my plea is in the response is that we take the poorest people in our cities and we put them right at the center of our city development strategies, because that will be the key to the success of that city.
Fantastic. Thank you very much. I think that's been really, really interesting, really insightful, and really important. But then we have the money question. We have the big money question. How will this vision for sustainable cities be financed? How will this vision of inclusive cities, as Greg, you just said, putting the poorest at the center of our vision, of our strategy, but also our financing? How is that going to be realized? So on that, we have a message from Dr. Marcos Troyjos, president of the New Development Bank, who was formerly Brazil's Deputy Minister of the Economy in charge of foreign trade and international affairs. Dr. Troyjos holds a PhD in sociology of international relations from Sao Paulo. He will tell us a little bit about what is new about the New Development Bank and how it can catalyze financing ecosystems to deliver citywide and local level impacts with the most vulnerable at the center. So if we can have the message from Dr. Marcos Troyjos, please.
It is an honor to speak on behalf of the New Development Bank, the NDB, at this first SDG Cities Global Conference. The conference represents the important mission of supporting the sustainable development of cities. And it holds a special meaning for us here at the New Development Bank. First, because the city of Shanghai is our home. Second, because the SDGs are part of the DNA of the NDB. And third, because the development of cities is at the core of what we do since the very foundation of the New Development Bank. Back in 2016, the NDB's very first project, the Shanghai Lingang Solar Power Project, was a symbol of the commitment we have at the NDB to the sustainability of the city's agenda. It was also a commitment to the municipality of Shanghai. Through that project, the NDB supported the government of Shanghai in building a resilient and sustainable city. The aim was financing the development of the city's renewable energy capacity. The NDB provided resources to 36 sub-projects across 7 districts here in Shanghai. Pudong New Area, the district where our headquarters is located, is also a beneficiary of this project. With that intervention, the NDB helps avoid 52,000 tons of carbon dioxide each year. That is equivalent to carbon emissions of over 11,000 vehicles on the roads of Shanghai. That project provided care for the basic needs of the people, as well as the environment we live in. It is in full alignment with the SDG City's mission. Ladies and gentlemen, beyond our projects in Shanghai, the NDB has been and will continue to be the catalyst for financing sustainable development. Over the past 60 years of operation, the NDB has expanded the development impact across its member countries. We have contributed to sustainable urbanization initiatives in more than 46 cities in the BRICS. As of today, the NDB has approved around 80 infrastructure projects. That's about $30 billion in project approvals. And a big share of NDB's financing is conducive to building resilient and sustainable cities. Urban development, water, sanitation, social infrastructure, clean energy, transport, these are some of the major sectors of our operations. And in all of those areas, the NDB strives to mainstream sustainability. More than 5 billion people are projected to live in cities by 2030. Mitigating and adapting to climate change at the city level will be paramount, and we must protect the livelihood and infrastructure in urban areas. We also seek to apply technology and innovation whenever possible to enhance the impact of our interventions. By doing so, we believe that we can strive to support projects that fit into the scope of development needs in the 21st century. Ladies and gentlemen, COVID, as we all know, has added even more complexity to these scenarios. Cities are on the front line of coping with the pandemic. Preventing, responding, and facilitating recovery for sustainable cities were never so urgent and relevant. I am proud to say that the New Development Bank was the first multilateral development bank to provide emergency assistance to cities that were hit the hardest by the pandemic. In total, we have committed $10 billion to pandemic-related emergency assistance relief. That's 30% of our portfolio directed to saving lives and supporting economic recovery. The impact of COVID on urban areas cannot be underrated. Cities in developing countries particularly, with some 1 billion people living in dense and overcrowded informal settlements, has been hit very hard. Poor access to services, hurdles in teleworking and digital infrastructure, all this makes vulnerables in the people's lives struggle with health, economic, and social consequences. And multilateral development banks, such as the NDB, must do their best in terms of having cities overcome these challenges. 95% of urban expansion in the next decades will take place in the developing world. This is both a huge challenge, but we also see it as an opportunity for development. Well, ladies and gentlemen, investing in cities have multiplying effects of different natures. They are felt in the quality of living, in productivity, in innovation, in a wider access to opportunities. And definitely more financing is needed. We must continue to focus on unlocking different sources of funds. This will help us bridge the financing gap by achieving SDGs across the world, especially when it comes to cities. And by mobilizing these additional resources, the NDB will be able to promote even more investment that benefits cities. And this will leverage the bank's capacity to finance public and private infrastructure, particularly needed at subnational level. The bank will continue financing big and medium municipalities directly, but we're also working with other financial institutions so we can reach smaller cities. Driving cities to meet their economic potential, ladies and gentlemen, takes considerable commitment. Cities need support in regulation, project preparation, de-risking. These are factors that crowd in investment. They scale up resources. We here at the NDB are open to working more and more together with all relevant stakeholders. And we look forward to strengthening ties with the UN Habitat and the city of Shanghai in making this vision come true. Thank you very much.
Wonderful. Important to unlock different sources of financing, but also I note the point around, you can finance big and medium-sized cities directly, but how do you reach finance to the smaller cities that need it most? And I think that's something we collectively, Cities Alliance, UCLG, and UN Habitat need to work towards in order to facilitate that process and that pathway of financing flowing to smaller cities and intermediary cities. Great. Let me now turn the floor over for a final presentation and overview of the SDG Cities program and the conference to my good friend and colleague, David Aubrey, who is the interregional advisor with UN Habitat. David provides urban policy advice to governments, and he leads our flagship program, SDG Cities. He used to head our regional office for Arab states. And before joining UN Habitat, David has worked with international organizations in Sri Lanka, Kenya, and Kosovo. A very long time ago, he used to be an architect in London, but I'm sure he's happy to have left that behind. David will give us an overview of the SDG Cities program and run us through what we can expect in this conference over the next couple of days. David, you had 10 minutes, you now have 5.
That's fine. Thank you very much, Shipra, and thank you for these amazing panelists, and that's as created the background for this conference so brilliantly. SDG Cities simply asks 3 questions, and we can sort of, if we use this wheel as a way of as an image of understanding the program, if we look at the wheel, each spoke could be an SDG indicator. The rim is 100% achievement, the center is 0 achievement. And we ask, how far will you get by 2030? And we've already said, and I liked what Emilia was saying, we're in the middle of it's not just a health crisis. We have to deal with health, we have to deal with climate change, we have to deal with inequality all at once. And the SDGs brings that together. Now, we don't know if every city will achieve 100%, but they can have a vision. And this comes back to what Greg was saying about strategic city development planning, bringing the entire city together on a common vision of where they want to be by 2030. That's the first question we ask, is how far will you get by 2030? And then it asks, how far have you got already? And we need data, we need metrics, we need to be able to measure where we are now, and we need to be able to properly scope out where do we need to be by 2030. And then that needs to be translated into action. And it means that maybe our spending patterns need to change. We need to, maybe we'll get greater SDG results if we focus on those communities that have been most left behind. Maybe that's where the greatest transformation is. So the question is actually a political question when we start asking, where are you going to spend your money? Where are you going to put your resources? Where are you going to put your efforts? How are you going to translate that into projects? The way then the SDG Cities tries to support is through linking data with strategic planning, which engages the entire city in that process. Keen that we work with Cities Alliance and its partners on this. And then the identification of projects, and then how are those projects going to be implemented? And this is why NDB is interesting, because it talks about an ecosystem of finance. We need to think about not just private finance, not just public finance, not just philanthropies, but how these work together to be able to drive the financing impact, particularly in small communities, particularly in small and secondary or intermediary cities. But at the same time, we need to build those local capacities. So we're also, an important part of this is to look at the key drivers of change needed locally: governance, planning, municipal finance, service, equitable service delivery. By bringing these together and working at scale, we have this huge ambition to support 1,000 cities and improve quality of life of 1 billion people. And we're the first to say we cannot do it alone. We are putting all the tools that we've had for the last 5 or 10 years in a digital format so that cities can access them much more easily than before. And where cities don't have digital access, hopefully Habitat or its partners have people on the ground that can support. We want to reduce our travel. We want to provide remote technical support to these cities. We also realize that sometimes some tailored support are needed. But when we understand the needs of several cities, we can group them together and walk with them as in groups of communities of learning. We need to be constantly updating our knowledge, constantly updating our tools. And the only way we can do this is through partnerships. We welcome partnerships with academia. We welcome partnerships with city networks. We welcome partnership with civil society organizations. We welcome partnership with those people who are determined to invest in impact. And so by bringing this global collaboration together, we expect to drive change. We cannot do it alone. We also want to recognize change, and this is why we're introducing the Sdg City Certification process, which certifies commitment. It certifies institutional changes. It certifies impact. I'll leave it there. So the conference that follows, we are looking at different elements of this value chain. So the next session, we're looking at data. We're introducing the Global Urban Monitoring Framework. We are then talking about the voluntary local review, where cities can report and measure and monitor their process and articulate their visions. We're then looking at the SDG City Cycle, connecting data to the development of projects, but also to building municipal capacities. And lastly, we are looking at how do we finance this? And we'll be introducing the City Investment Facility, which has recently taken off, and it really helps to channel various sources of finance to the development of cities. And then the last day, our guests, we're very pleased to have the Global Sustainability Index Foundation, as well as Global CEO Alliance, the great supporters of this program. They'll be talking about health, and they'll be talking about digital transformation. Shipra, back to you. I may have gone 1 or 2 minutes over. Thank you.
That's okay. Thank you, David. Thank you for that crash course. And we will have a chance to develop all of that over the next couple of days of this conference. So I'm sorry to rush you, but I think that was a teaser. And it's important that people stay connected with us over the next couple of days if they wish to learn more and join hands with us. For me, maybe it's 4 or 5, 3 to 4 takeaways. First of all, the path to prosperity leads through cities, from poverty to prosperity, but also the path to reduced inequality, stronger climate action, both mitigation, adaptation, and the health and the socioeconomic crisis that we are facing. The path out of these multiple complex crises that we are facing leads through and beyond cities, leads through a process of sustainable urbanization. I think that's very clear. Second, investing in the basics is important, but as long as we keep our eye on the ball, that we are really aiming to transform fundamentally dysfunctional systems of the past. I think that's absolutely fundamental. This is not just about infrastructure. It is about our social systems, our economic systems, our governance systems, our political systems, as much as our physical systems. And I think that's quite important and quite strong. And the SDGs will not be achieved unless there is a radical transformation in this entire set of systems that we're talking about. A third, I think, very important point, that we're really talking about people at the center, putting the most vulnerable, and perhaps because cities cannot do everything, they cannot finance everything, they don't have the capacity to do everything at the same time. They need to really focus their attention on those that are getting left behind and have traditionally been left behind in development processes and in the climate emergency, and therefore also in the health emergency. We also need to focus much more on smaller and intermediary cities where future growth is going to take place. And that's a point that came out quite strongly. That's where future growth will be, and that's where capacities are most limited, and that's where our support is more needed. We don't need a new NATO. We need our multilateral system to work. We need more voices, more stakeholders, the right stakeholders, the new stakeholders around the table. We need an empowered WHO. We need an empowered UN Habitat. There's my plug. And we need an empowered multilateral system that engages particularly the local stakeholders, including local and regional governments, but also other stakeholders who are making a difference around the world on an everyday basis. We need better data. We need more informed evidence-based, more informed and more evidence-based policy making. And we need to deliver those services and those support and those capacities to a very large number of cities. So we need to go to scale quite quickly and effectively. And for that, we need to use technology more effectively in terms of providing that support to cities at scale. I think those are to me the most important points. Mapping vulnerabilities, I think it's important. Greg said and Eduardo said, knowing your city and knowing the vulnerabilities in your city and knowing what to target, who to target, and which systems to target, which will lead to transformative change. And then finally, the whole idea that we need to transform the financing ecosystem. Big cities, medium cities can access financing directly, but smaller and intermediary cities can't. How do we make sure that we develop the pathways and the models by which these cities, which are in dire need, can access financing to address their needs and to achieve the SDGs? So with those synthesis, that attempted synthesis, I would say, I would leave it there and stay with us for the conference for the next 2-3 days. A huge thanks to, of course, Professor Glaeser, who's left us at Glaeser, but Emilia, Greg, Eduardo, David. There's some very interesting comments, observations in the chat. And if we are staying at this Zoom link, we will continue that conversation over the next 3 days. Thank you very much. And have a wonderful conference and a wonderful day. Thank you.